This educational video, I'm going to be covering why pain in the rhomboids actually isn't a rhomboid problem. Those of you that might not know who I am, my name is Dr. Matt Maggio. I am the creator of the 𝐓𝐡𝐞 method and the founder of the Soft Tissue Revolution, where we teach manual therapists a new treatment system that focuses on working smarter, not harder, which will allow them to cut their treatment times by 50% so they can stay healthy and help a hell of a lot more people get out of pain. So this area back in the rhomboid is probably the most common area in the human body to get pain, dysfunction, tension, all sorts of problems in there. And the true cause of it is actually missed by a vast majority of providers. They simply think it's like a rhomboid problem, but it's really not. So symptoms are really important. They let us know that there is in fact a problem in there. And usually what I see in the musculoskeletal world, in the training systems, in the courses, the techniques, all that stuff, there's two types of providers. Number one is there's the providers that only treat and focus solely on symptoms and where it hurts. Then there's the other providers that only treat based on referred pain and trying to figure out that it is coming from something else. And they'll even contribute it to like a vast array of stuff. I've seen the lymphatic people be like, oh, your whatever gland is stuck and it's referring here, or visceral pain and all that kind of stuff. They're really just trying to get away from the musculoskeletal aspect of that. So there's the ones that only treat exactly where it hurts. That's going to be your orthopedic model, chiropractors, things like that. And there's going to be other ones that are like, it's got to be coming from somewhere else. Here's the thing. It's somewhere in the middle for sure. Yes, the symptoms are important. They tell us there is a problem, but they're not everything. So key question I always ask in all my history questions. Yeah, you should be taking a history before you treat anybody. I get so pissed off when I see providers like, well, I'm just an intuitive healer. I'm just going to get in there and see what the tissue tells me. It's going to talk to me. It's going to whisper to me. Bullshit. Get the hell out of here with that stuff. You need to do a thorough consultation, history taking, whatever you want to call it. And what I do in mine is I do at least 12 questions that I ask. If you're watching this on YouTube, what I'll do is I'll link it up top and really goes through the 12 questions that I ask before ever doing an evaluation or ever treating a client. If you're watching on LinkedIn, I will put it down below in the descriptions. And one thing that can really tell me if I'm having like more of a local problem or a referred problem is whether or not there was like an accident or some trauma, or do they do some type of like in their athletics or their job, like some type of unilateral motion? Are they using one arm more than the other with what they do for work, what they do for a job? So if there's no trauma and there's no unilateral type of movement in their athletic endeavors or their job, then I'm not thinking it's a rhomboid problem. So there are two areas that can cause issues in that rhomboid region, but they're not actually a rhomboid problem. The first one is going to be what's called a sclerotome referral. Sclerotome referrals, especially from C5 to C7 in the neck. And a couple of questions I ask in the history is definitely the severity of a problem. So when I do a severity questionnaire for a client, I give them some guidelines and some markings of where I want to be. So I say on a scale of 0 to 10, 0 being no pain, 10 you wouldn't care if we just cut it off, what is the worst that problem has ever gotten? Then I also ask them, when's the last time you had an episode that bad, and what's it been on the average for the last 30 days or so? So a lot of times when it's a sclerotome problem, it's usually like up in that like 6, 7, 8, 9, even 10 range, because it's referring problems from the joints in the discs in the neck. And another thing is the quality of the pain, what it feels like. A lot of times they're going to say things like it's sharp, it's stabbing, it's throbbing, it's really, really intense. So if this does end up being the problem, I'm going through my history, my evaluations, and I find dysfunction, a lot of my treatment is actually going to be focused more in the neck, especially from like the C4 to the C7 levels in the neck, because that's exactly where those sclerotomes are going to refer pain in there. And I'm going to do some treatment on the nuchal ligament. I'm going to do a lot of work in like the medial cervical erectors. I put those all in like one group together. So basically what happens is all the muscles in the neck, they kind of run their way up and they can all get kind of stuck together. You can find it in the trap. You can find it in semispinalis capitis, semispinalis cervicis, splenius capitis. And what happens over time is those muscles, they're supposed to be separate in function, but with bad posture, looking down, all sorts of stuff, they get really beat up. They don't get enough blood flow, don't get enough oxygen, causes scar tissue or adhesion to lay down, which in turn puts pressure on the discs and the joints. When it does that, it will refer the pain. So my treatment is going to be focused around the muscles around that area to unload the disc or the joint. I always say, think of the disc or the joint as like their thumb stuck inside the car door. The car door is all that scar tissue. You can't give this a chance to decompress or heal up until you get all that scar tissue out of there. So that's how I manage if I think it's a sclerotome referral. The next one I end up seeing a lot is an entrapment of the dorsal scapular nerve. Now, nerve entrapments are a really, really big deal, and they're often missed so much by providers. You know, a lot of nerve entrapments, I think last time I checked, there's like 156 different places in the human body where a nerve entrapment can in fact occur. And a lot of times the severity in that scale, you know, that 0 to 10, they're going to be less. They're not going to be as intense. And the quality is going to be more like a numbness, an aching, maybe a little bit of burning, and even some tension in there. Because what happens over time is nerves need to make their way through the muscle, through the fascia to get where they need to go. They're usually built with like 15% of like extra slack. Over time, that scar tissue adhesion builds up with poor posture, shitty diet, all that kind of stuff. And then that scar tissue gets bigger and bigger, and eventually it gets stuck to the nerve. When it gets stuck to the nerve, it creates that nerve entrapment in there. So if I am seeing more of like less severity, but in that symptom location of the rhomboids, and it's more numb, aching, burning tension, I'm thinking more of that dorsal scapular nerve. So if this is the case, then my treatment's going to focus on a manual approach. Specifically to the area where that nerve gets caught. It's usually going to be like, it can get caught anywhere from like T2 to like T5. And what's going to happen is we're going to shorten that area. It's going to allow me to get proper depth and then tension. And then I have the client go through a full range of motion as I'm applying proper depth and tension. That's going to break down that nerve entrapment of the dorsal scapular nerve. A lot of common faults I see with other providers treating it is way too much depth. And a lot of times they'll use their elbow to get in there. Don't be a jackass and use your elbow. You don't get any feedback. And all you do is jam the hell out of the nerve and piss it off. And then the client's like, oh, it hurt like hell. It must be doing something. Nah, you're not doing anything. You're just pissing that area off. The nerves need just the right amount of depth and tension to break them down. They're like Goldilocks. They need everything just right. And if you have too much tension, not enough tension, too much depth, not enough depth, it's not going to be effective. It's going to hurt like hell, and it's not actually going to fix anything. And that nerve entrapment will still be there. And then you'll be back the following week or 2 weeks later, still working on the same area, but not actually fixing it. So a couple take homes from the video. Number one is slow the hell down. Ask questions. Be a clinician first. Don't give me this crap about, I don't need to take a history. I just know what's going on. I'm an intuitive healer. Get the hell out of here with that stuff. Ask questions. Figure out what the problem is, because you can't fix a problem if you don't know what it is in the first place. And get out of that idea of going into that like default mode of like, just because it hurts somewhere, that's where the problem must be. The client's like, well, it hurts in here. Why aren't you working here? You know, and I'm like, you know, the clients will railroad you a lot. They'll be like, well, it hurts here. This must be the problem. And I'm like, oh, really? Where did you get your advanced medical training? Like, you don't have an idea what's going on. Don't let them railroad you, and don't just go in there just to appease them. Actually do the work. Be a clinician first, then a technician. And instead of doing more treatment, you know, you're always looking to do like more, like what else can I do here? Can I put some cups on it? Can I do some lymphatic draining? Can I do some stretching? Can I throw some tape on it? No. Instead, focusing on doing the right treatment, the right amount, and getting results instead of just throwing a bunch of stuff at it and seeing what's happening. If there's any insights that you have, you know, feel free to share them in the comment section. I always like to, you know, banter back and forth about what people might think about this. Share this video with any other providers that you know it might help, especially those ones that are just jamming their elbow in people and beating the crap out of them. And lastly, go grab our free training. This is where I go way more in depth about using your brain first, learning to work smarter, not harder, and all the information for that is available wherever you're consuming this, in the show notes in the description. I appreciate you guys watching the video, and we'll see you on the next one. Bye.